Hi, welcome to Digital Slide Review and Sign Out. I'm Dr. Lewis Hassel, Professor of Pathology at the University of Oklahoma Health Sciences Center, and I'm grateful to have you with me. We're going to talk today about an interesting case of a 60-year-old woman who has discovered a thigh mass. She's not sure how long it's been there. It's been a little bit uncomfortable, but and somewhat palpable, sort of like a roll, as she would say, that she felt. Um, Radiographic imaging, of course, followed, but this was somewhat complicated by the presence of significant obesity and this uncertainty as to duration, the lack of any history of injury. And of course, in some of these situations, biopsy can sometimes be less than definitive. And here's kind of what we're dealing with radiographically. You can see here on the T2 fat sat that it's got quite a multilocular appearance here. It's adjacent within this muscle compartment, a little bit not really the density of fat here on the transverse section. But as we do some sagittal sections with additional imaging, we can see there is a fair bit of fluid accumulation and some sort of almost cystic type changes associated with the lesion here. It does seem to be nicely contained within the muscle because we see very nice sharp borders without any infiltration beyond that on this image. So considerations in this case radiographically were somewhat diverse, certainly looked like a or probably low grade or benign lesion with a lot of fluid, potentially some cystic changes associated with it. And so a biopsy was obtained, and that showed the features that we see here. You can see that we have low cellularity tissue, a lot of pale blue kind of tissue with some scattered cells within it, a few delicate vessels, as you can see at low magnification here. And also up here, you can see a few scattered thin blood vessels with some areas of more dense fibrous tissue. Well, there are a lot of lesions that can look like this. We'll go to a little higher magnification just to appreciate that, we might have a few mast cells in the lesion. There you can see maybe a couple of darker cells with more slightly granular cytoplasm. We don't see any significant atypia. No mitotic figures certainly identified here, and no specific differentiation. So a myxoid low-grade spindle cell lesion could be a variety of things in this location, but certainly the most frequently encountered thing you'd be thinking about would be an intramuscular myxoma. But we shouldn't just stop at that and sign it out and set that way because there are a number of things that also could be present. So the case went to resection, and here you see this nicely multi-lobated mass, obviously fairly sharp margins, rounded appearance on the edges without evidence of invasion. But these are the things that we should be thinking about histologically with a myxoid background. On the benign side, in addition to intramuscular myxoma, there can be nerve sheath myxoma, some myxoid lipomas, juxtarticular myxoma, probably not in this particular location, but histologically in the differential diagnosis, and sometimes nodular fasciitis. Again, not clinically a feature with regard to the MRI findings. On the malignant side of things, certainly myxoid liposarcoma, myxoid chondrosarcoma, myxofibrosarcoma, a higher grade tumor, low grade fibromyxoid sarcoma, certainly a possibility, as well as on rare occasions in low grade in other locations, a well differentiated liposarcoma could potentially have this appearance. Although those typically do not have a lot of myxoid tissue, we have seen a few examples of that. And then other higher grade tumors like endometrial stromal sarcoma or myxoid leiomyosarcoma would be possibilities, though unusual in this particular location. So we've got the resection specimen, and here we are looking at it, and we see this lobulated appearance, little bands of fibrous tissue in between. And again, the very low cellularity, sparse vascularity, and none of the arcuate, arcading type of vessels that we associate with myxoid liposarcoma. Very loose matrix here, uh, sharp borders. Although in sometimes, as you see here, we can have areas of extension into other areas of the muscle, and probably that's what's going on here. So it's not totally contained, and making sure that you get good margins is of course valuable. Um, an additional section here showing almost a pseudarthrosis. You remember she mentioned that it seemed to have a rolling character, and that may be this may be one of those features. Perhaps that pseudosynovial type extension off of the lesion into adjacent tissues with that sharp fibrous bound could have this kind of a correlate. Obviously, this has collapsed down here considerably. And on gross evaluation, there were areas that sort of had a cystic change to them, as we saw. And you can see how that can happen with the abundance and accumulation of the ground substance here in areas with virtually no cells. So this is certainly an intramuscular lesion. It's got the myxoid changes, the sparse vascularity, and we should arrive at the diagnosis of intramuscular myxoma. Well, what is this lesion? Well, it's usually an indolent soft tissue tumor that occurs in adults, a little bit more frequently in women. Proximal extremities and the deep muscular tissues, that's the location where we are. Low cellularity, sparse vascular changes, and occasional central cystic changes. Boy, we've just described it here to a T. Now, the one thing we didn't do was to look for molecular genetic abnormalities, and many of these tumors are reported to have GNAS1 mutations. That's not a particular prognostic or other significance. I guess it could be helpful in diagnosis, but not essential in this case. We've previously noted that these lesions can be seen in association with fibrous dysplasia and Mazabrod syndrome, and we'll provide a link to that in the notes as well as in the cards. So our final diagnosis is intramuscular myxoma, a benign lesion that the patient should do well, the conservative surgery. Now I put a couple of additional slides, digital slides for you to consider if you'd like to study further on this lesion in the link in the description for the video. Thank you so much for joining me. This has been a pleasure to have you with me, and I hope that this will be useful in your encounters with soft tissue lesions of this sort in the future. So until next time, again, thanks for joining me.